Beautiful. Our senators we're cross-trained in how to move boards, people.
How's it going?
We can hold posters.
Sorry, just had to put a few fires out.
Oh, yeah. Well, ladies and gentlemen, I just want to say good morning to everybody and thank you for everybody for coming. My name is Senator Michael Hastings, Hastings. I represent the greater southwest suburbs of Chicago. I'm joined by Senator Bush, Senator Peters, Senator Castro, a lot of stakeholders in our march to mental health. I just want to say thank you for taking the time out to cover this very, very special topic in the state of Illinois. I represent the southwest suburbs, like I said. I had the closure of the Tinley Park Mental Health Center, which displaced mental health patients across the south suburbs, and it's had an abnormal effect onto our local hospital systems in terms of volume. Sometimes it's difficult for our hospitals to take in all these patients and be able to provide mental health care and treatment to them. Also, there's some issues as well, geographic issues in terms of where people can get their treatment at, and that's why it's important, I think, as the Illinois Senate to tackle these issues head on. And as we say, we're going to march to mental health, that being it's March, and Mental Health Awareness Month is in May, but we want to march early and get something done here in Springfield. So there's a lot of different bills. Obviously, the senators will outline the 5 separate bills that are introduced today. I'll just make a quick remarks in terms of Senate Bill 1715. Senate 1715 allows for pharmacists to be allowed to inject antipsychotic medication into patients. Not only in the community setting does this have a major impact because injectable medicines could have a duration of 60 days. So it's a long-term medicine, so people with mental illnesses who need mental treatment, they don't forget their medicine. This is a 2-month process. I'm proud to have the SIUE pharmacy team here as well here in Springfield. I know they're excited about it as they're going to be taking part of this once the law is signed into law. So it also has a great criminal justice impact as well. For those that are leaving our state penitentiary system or our Cook County jail system, they have it hard enough trying to find where a place to live, find a job. Being able to get a long-term injection to help stabilize their mental health issues that they have, this will allow them to focus on those issues. So I know we've had a great collaboration with Garth from this Pharmacists Association, Mrs. Sosa with the Psychologists Association, the State Medical Society. They do a phenomenal job, and I just want to say thank you to them for coming together and collaborating on this. I'll stop and I'll introduce our great senator from Grays Lake, Senator Melinda Bush, to outline her bill as well. Thank you, Senator.
Thank you so much. Thank you. I'm State Senator Melinda Bush. I represent the most northeastern part of the state. So I'm Lake County, and certainly, you know, we hear stories every day about we get a call from someone who has a loved one that's out on the streets, frankly, and isn't getting their medication and dealing with mental health issues. It's something we know that for far too long we haven't done everything that we need to be doing. Anyway, so for far too long, mental health, which often goes hand in hand with substance use disorder, wasn't talked about, and the stigmatization that went along with it. Often, and still does, it leaves people with nowhere to turn. 75% of severe mental health disorders manifest in young and adolescents, but it takes on average 8 to 10 years for a person to be properly diagnosed and treated. We know that early detection and treatment can often determine whether a person is able to continue to pursue an education or participate in the workforce or, frankly, be an active part of our society. Last year, working with Heather O'Donnell and Thresholds, I passed the Early Mental Health Addiction Treatment Act. This created 2 pilot programs for Medicaid beneficiaries, one that provides community-based wraparound services for treatment of mental health conditions in youth and young adults, and one to treat youth and young adults with substance use disorders. We're working with the Department of Health and Family Services to ensure that we get federal approval so that these pilot programs can be implemented. But we can't stop there. 60% of Illinoisans have private insurance, and of those, it's estimated that 1.5 million have a mental health condition. Yet private insurance does not cover some of the most effective, evidence-based treatment approaches for serious mental health conditions that are proven to stabilize symptoms early on and prevent its progression. Requiring insurers to cover the most effective treatment methods is common sense. It's good for patients, will save money in the long run for both private insurers and the state of Illinois. Now I'd like to turn it over to my colleague, Senator Robert Peters. And thank you for being here, and thanks for paying attention to mental health issues. It's really important that we start to discuss these at a much more rapid pace, so thank you.
Thank you. I'm State Senator Robert Peters of the 13th District on the south side of Chicago. I'm sponsoring Senate Bill 1188, which provides that if a court determines a defendant in a misdemeanor case is mentally unfit to stand trial, the court can direct the defendant to diversionary programs rather than into the criminal justice system. There is an alarming number of people struggling with mental health who have been convicted of misdemeanors despite being unfit to stand trial for these crimes. And as a result, a lot of these folks end up stuck in the criminal justice system for longer than their original sentence. By allowing these people to be transferred into misdemeanor diversion programs, we can give them the help that they so desperately need, which comes not from a jail cell, but from a program designed around their rehabilitation. Access to mental health treatment is extremely important, not just for those who are interacting with the criminal justice system, but to anyone who needs it. There's a disturbing lack of focus placed on mental wellness, and that can lead to a dangerous situation where people with treatable mental illnesses don't receive the treatment they need and pose a threat potentially to themselves or others. There's a stigma that's placed not only on mental health issues themselves, but seemingly on the mere discussion of mental health itself. That stigma needs to be eliminated. Mental health issues are real and are potentially serious, and folks who suffer from them need to be able to both talk about their issues as well as get the necessary treatment that require them to get better. And we need to move away from criminalizing mental health here in Illinois and in the United States. So I'm going to turn it over. Yeah.
So we have a couple, just want to make sure a couple of our senators that are here today, Senator Castro and Senator Harmon, just wanted to make sure, I wasn't sure if it was on the list or not, but we're all good. I wanted to introduce some of the advocates that have been working with us on these mental health issues. We make sure we take the input from our stakeholders. There's two great ladies here today, Heather O'Donnell and Jen McGowan. I just want to make sure, Heather, if you wouldn't mind coming up saying a few words, explaining what your organization does and how these impact your bills.
Good morning and thank you. My name is Heather O'Donnell. I'm the Senior Vice President of Public Policy and Advocacy for Thresholds, which is a community-based mental health agency that serves about 10,000 people across Chicago and the collar counties. And I just want to thank all the senators standing up here today to support these really important bills. People with mental health conditions, they begin to show symptoms mainly in adolescence and young adulthood. But most people don't get treatment until they're far into adulthood. We need to start treating these illnesses like they are any other medical condition when their symptoms first begin to manifest. The bill that Senator Bush is carrying would cover first episode psychosis, which is covered through federal and state grants, and also will be covered through a pilot program under the Medicaid program, but it needs to be covered by private insurance. Most young people have private insurance, and best practices ought to be covered through private insurance. And then we also need to make sure that people who have mental health conditions are able to get their medications. And the two bills that Senator Hastings is carrying related to medications would enable them to get the medications that their doctor prescribed in an easier fashion. So thank you.
Next, I want to introduce Jen McGowan.
Good morning. Thank you to the senators up here for allowing me to say a few words today and for your invaluable leadership on these efforts. My name is Jen McGowan-Tomke. I'm the Associate Director of the Chicago affiliate of the National Alliance on Mental Illness. NAMI Chicago supports individuals and families impacted by mental illness, works to reduce stigma, and advocates for a more effective mental health system. We believe that these efforts to improve access to needed mental health treatment are incredibly important for individuals living with chronic mental health conditions. We know that barriers to mental health treatment are often too high, making living in recovery challenging and creating understandable frustration with the current mental health system. At NAMI Chicago, we receive calls from individuals who know all too well what happens if they or their loved ones do not have access to treatment that's working for them. For chronic, complex conditions like serious mental illness, finding an appropriate medication or treatment can take years. Once treatment is working, ensuring stability through mechanisms like reducing prior authorization and access, such as broadening providers who can administer medications, are really key to recovery. The legislation being discussed today are steps towards making treatment more accessible and stable for individuals with mental health conditions. We must continue to fight to make sure that all Illinoisans are able to engage in the care that works for them and reduce ongoing barriers to services they need, whether it's medication, therapy, or wraparound support services. We're grateful that improvements to the mental health system are at the center of this conversation in March to Mental Health, and to the senators here for working to cut down these barriers to treatment. Mental health conditions are common, they're treatable, yet 55% of adults in Illinois living with a mental health condition did not receive treatment in 2017. We must do better, and these efforts are examples of how we can push forward. Thank you.
So with that, I just want to say thank you. Obviously, it's very important. Mental health doesn't discriminate against any race, religion, gender, doesn't matter. It affects everybody young and old, and I think it's important that we march to mental health, and I'm proud that the Illinois Senate is marching towards this progress. So thank you very much for coming, and we'll open up the questions.
Senator, 1715, your particular bill, can you just speak to what's the need for pharmacists to be able to do this? Is there currently a wait time? Are people not getting their medication for the injectable?
There's an access to care component of this. We want to make sure that people who have mental illness don't have to schedule an appointment with their primary care physician. They can go to the pharmacy and get an injectable, which provides long-term medication for those with mental health. Obviously, we work with Psychiatrists Association, the Pharmacists Association, to make sure that people are trained and ready to go when it comes time to giving somebody an injection. It's not uncommon for pharmacists to give injections already. They give immunizations, birth control shots, and other things. This will be an added component of their practice.
Have they already gone through training?
They have training right now in their curriculum, but this being antipsychotic medications, we want to make sure that they understand the complexities of maybe side effects, some other things that may happen if it goes once they inject them.
Chicago, I think what they care about are the issues we're talking about. What are you going to do about the schools? What are you going to do about fixing the financial situation of the city? And what are you going to do about the level of crime and ensuring that we have safe neighborhoods? Would I be right on that?
Yes.
The Illinois Channel, keeping you connected to your state, your issues, your home.